All right, continuing with our ethical questions for the medical residency interviews. I'm Dr. Khan. I'm going over a series of questions, ethical questions, and I actually have other videos on regular questions. Tell me about yourself, tell me about your 3 weaknesses, all of that. However, ethical questions are what get people in trouble. And today we actually have a tough one. What will you do if you knew that your attending physician was working under the influence of alcohol, and that generally could be any drug? So I'm going to provide you with a sample answer, a framework how you will craft your response, and some really do's and don'ts, and we will dive into the philosophy of how you would look to answer this question as well as other similar questions. So here's the situation. You notice you are in morning rounds that Dr. Smith, he seems a bit too relaxed, a bit too tipsy, and he seems to be slurring his words a bit. He seems not to be balanced, and you feel that he may be under the influence of alcohol. And you also know that the program actually had an outing last night, so it goes into the scheme of things. So you have a strong suspicion. So this is what the interviewer is going to be asking you, that, hey, okay, you feel that in morning rounds your attending actually has issues, and you feel that he is under the influence of alcohol or any other substance. What are you going to do at that point? How will you manage that situation? All right, so a strong response will actually highlight your concern for patient safety. And it will also highlight your respect for professional boundaries and your understanding of the policies of your institution. For example, if you suspect that an attending is working while under the influence of alcohol, and here is an example of a sample answer. Hi, that is an excellent question. If I suspect that an attending was working while under the influence of alcohol, my immediate priority would be the safety and well-being of our patients. I would try first to discreetly confirm my suspicions. I would try to see that is this actually true. I would not jump to conclusions. However, I would observe him a little bit more. If I see something, then of course I have to say something. If my concerns were validated, and normally you have a resident team, maybe you can look at your resident and say, hey, does it look a little funny? If they also suspect the similar thing, then something has to be done about it. I would approach my senior colleague or supervisor to report my concerns in a confidential manner. For instance, I might go and say, hey, I have a serious concern regarding Dr. Smith, and I believe that he may be under the influence of alcohol, and I'm worried about patient safety. Can we look into this matter as soon as possible before any adverse event happens? So this type of answer ensures that the issue is addressed by someone in a position of authority and minimizes the risk of a direct confrontation. Because let's face it, confronting somebody who is your superior or who may be under the influence of any type of recreational substance, it may be difficult for a resident to actually handle that situation. So this is how I would look to approach him. I will not approach him directly. I would definitely bring it up to my supervisors. I would definitely bring it up to maybe a senior resident, a third year resident, or chief resident for that matter, or possibly the program director. And I would also say that I know he is an excellent attending. Maybe somebody can have a look at him and talk to him that, hey, maybe you want to sit down for a couple of hours until you are feeling possibly better, or maybe take a break for today and come back in tomorrow. So that was a sample answer, and hopefully this was helpful. So the priority is always to maintain patient safety and uphold the integrity of your medical profession. And make sure that you do not turn this into a carnival. I know things happen, and you may want to spread rumors that, hey, my attending was a little drunk today in rounds. So don't do any of that, because it will come back to hurt you and bite you. So let's break down the framework, and you can use this to craft your own answer and possibly respond to similar answers. So number one, you will always say that you will confirm your suspicion. You don't want to be seen as a person who jumps to conclusions and likes to tell on other people. That is not a good thing to do in any situation. So ensure that your concerns are based on observed behaviors and facts, and make sure you mention them when you talk about it, right? Then you have to, of course, report it to a supervisor discreetly. Confidentiality is important. Make sure that person is also respectable. So Do's and don'ts. Again, prioritize patient safety. Always emphasize that patient safety is your top priority, that you cannot let anything come between that. And of course, all of this is done respectfully and discreetly. And there are usually protocols for such in a residency program, that if you want to take a matter up, how will you do that? How will you escalate a particular incident? So all right, I hope this was helpful. I actually have more videos and more ethical questions, and I also have more videos on behavioral questions, for example. And if you're looking for more help regarding your residency interviews, I'm actually putting together a resource where you can possibly connect with me in a group setting, or possibly other options to help you prepare for your residency interview. I will look to have those links in the description. Let me know. Thank you so much.